my name is Cameron Fraser. To start, according to the Learning Styles Assessment, I'm an auditory learner. According to the Myers-Briggs Temperament Inventory, my personality is EFSL, extroversion, sensing, feeling, and judging. And after taking the Gardner's Multiple Intelligence Test, it appears that my strengths are my sense of self, my social skills, and language, which is great because I'm going into speech-language pathology. I'm taking this class because I have to fulfill it as a prerequisite for my master's program, which starts in the fall. So far, my experience with the special needs community is I have a family member, which I will talk about next, who had special needs, as well as I've done some volunteer work with individuals who have special needs. I worked as a volunteer at a school for children with autism spectrum disorder. And so I worked with preschoolers age 3 to 4 who had autism, and I learned so much from them. I honestly miss them. And later on in my internship work, I worked with adults who were living with aphasia, and I would help them with their speech and language difficulties. So the family member that I previously mentioned that had a disability was my mom. She had Parkinson's my entire life growing up, which eventually made her wheelchair bound, and she struggled with dysarthria and other speech related difficulties. Her Parkinson's progressed pretty severely, so she ended up with a severe disability. And I don't consider myself necessarily having a disability, but I do have a condition that changes the way that I operate through the world. I have epilepsy, and because of my epilepsy, I have to treat my body differently, my brain differently, avoid certain things that other people get to do, such as concerts with flashing lights, stuff like that. Something that makes me nervous about people who have a disability or a delay are probably just offending them, because I know from my experience working with people with disabilities, growing up with somebody with a disability, all they really want is, sometimes, I don't want to speak for all of them, but oftentimes what they want is to feel normal and not so much like the other. So I think that would be my biggest fear, is making them feel outcasted, ostracized, different, I think is what I mean to say by that. I definitely would never want to make anybody feel like they can't be themselves. My career aspirations are to be a speech-language pathologist. Particularly, I'm interested in working with adult clients who have speech and language related difficulties. My work with those with aphasia was really inspiring for my career, and so hopefully one day I get to work in a hospital with stroke survivors and be sort of the first person, beside a neurologist, but the first person that they interact with after they suffer a stroke. I would really like to be on the front lines of helping them with their journey. This class will definitely teach me some foundational skills about what sorts of different disabilities people have. This will inevitably be something that I run into in my career, as many people who have speech and language related difficulties also have another disability, a comorbid disability of some sort. So it will definitely teach me foundational skills in that way, and how to be a better clinician when treating such patients, appropriate language use, appropriate treatment techniques, things like that. In life, I think that everybody could probably benefit from a class like this. I think that people are often really afraid to talk about disability because it makes them so uncomfortable. So I think learning about them more will help me sort of break down the fear surrounding the topic itself. Because I think that if you are uncomfortable or afraid or uncomfortable of something, the best thing for you, and in this case the other person, that you can do is learn as much as you can about it. My 5 goals for taking this class are Just one, to learn about the various types of disabilities, because I'm sure there are so many that I haven't heard of or worked with yet, and I'm always interested in learning more about that topic. Number two is to learn how to be competent when working with individuals with disabilities, so I can provide the most appropriate care. Number three is to learn the statistics and prevalence of various disabilities, because that's something that I don't have information on off the top of my head. Number four is to definitely learn how to ease family worry about disabilities, because there are a lot of fears surrounding them. And as a future clinician, I want to sort of ease family fear, because their life will be different, but that doesn't mean that it's going to be impossible. And number five is become an advocate for those who have disabilities and learn how to encourage them and the world around them to not just deal with the disability, but embrace it. Because being different is beautiful. Thank you.